Hey, everybody. Today we are talking about healthcare professionals and grants. If you are a healthcare professional and you're looking to do continuing education, or you are looking to change your career to a healthcare path, uh, career, and or you want to get into doing medical billing and coding and you want assistance, today's show, we will be talking about how to pay for your college education, and also if you get into certification programs, if there's any funds out there for people who want to get certificates but don't have the funds to pay for them. My name is Ruby Simmons. I'm your medical billing mentor and owner of Blossom Revenue Cycle Solutions, LLC, where we believe a provider should never have to struggle between patient care and their revenue. And I would like to introduce Miss Angie Hill, Miss Angela Hill. I call her Angie.
Thank you, Miss Ruby. Thank you. Either way, I will answer to them. I am Angela Hill, better known as an inspirational scholarship coach. I work with parents who have high school students who are looking for scholarships for college, and they don't want to use those student loans. They want to avoid that student loan debt. And I thank you, Miss Ruby, for allowing me to be able to share your platform here.
Thank you so much for showing up. I had this idea and I was listening to you talk about grants, and I said, well, there's a lot of people out there who often wants to talk about continuing their education and getting into, medical billing and coding, getting their PhD, their MBA, and either, going to nursing school, and they would like to know if there's grants out there that would assist them. I'm mostly talking about adults who are looking to continue their education, and or adults that are looking to transfer careers into a healthcare path, whether it's healthcare IT or just becoming a healthcare worker like a nurse or CNA. But I thought it was a really good idea that we talk to people about this, because I get a lot of questions about it, surprisingly. I get a lot of people who reach out to me and say they're trying to decide whether they want to get into IT and or they want to do healthcare. And sometimes I answer them and tell them, why don't you do both? There's healthcare IT you could get into, and they didn't even know that there was such thing as healthcare IT. I said, there's all kinds of things in healthcare that you can get into that a lot of people don't know. But I thought this would be a good idea. So what I would like to ask you is, what are grants?
So that's a good question. To clarify it up, there are grants and there are scholarships. And a lot of people think, well, if they're applying for scholarships, they don't qualify for grants. And a lot of people don't even know that grants exist.
Mm-hmm.
So I'm going to talk about what scholarships are and the difference between a scholarship and a grant, and let people know that they could actually apply for both of them.
Oh, that's great.
Yes. Oh,
I
yes.
didn't even realize that. I was
Yes,
thinking grants
ma'am.
and scholarships was the same thing.
No, ma'am. No, ma'am. They're totally different. They do the same thing. Both can be used to pay for education, whether it's tuition, fees, whether it's supplies, any of the above. But scholarships can be government scholarships, they can be private scholarships. And so you can get those from individual companies, organizations who are wanting to fund college education for a student. And they are free. You don't have to pay them back. You don't have to pay them back. And that's what we want, all the free money that we can get.
Yeah.
And then the grants, they are strictly coming from the government, whether it is the state government or the federal government. All of that is government funding. And from scholarships is, as long as the money is there, it keeps coming in, people are funding that scholarship, the money is there for students to apply. With the government grants, it depends on how much government funding is there. And we know the government doesn't always say, okay, I have a lot over here for granting people to be able to go to college. But there are a lot of grants that are out there that students, adults who are trying to return back to college or who want to continue their education to be able to go to school on those grants, go to school based on government funding, but there are limitations compared to scholarships. So a grant, it could be based on your income. It could be based on the size of your family. It could be based on whether you're in a particular state. So there's a little bit more limitation on who qualifies for grants, because it's, you know, trying to get that particular person who has in that area that they're in, that they're living in a particular area, or they have they are an adult who in a one who's having who is raising children on their own without assistance.
Yeah.
And so that kind of puts a limit to how many people can qualify for grants. But there are grants out there for people who actually want to have that funding to be able to. They just have to be able to know the right places to search for them and actually apply. Because a lot of times people will say, well, I'm not in this, so I'm not even going to qualify, so I don't even apply. And that's, you know, leaving money on the table. And of course, for government funding, there's always a limit on the time that you can apply, and if there's a cutoff on how many people can receive the funding from government. So the main difference is with the scholarships and the grants is the qualifications and who actually can apply and how much money that grants have compared to the scholarships.
Oh, that was a nice explanation. I didn't realize it. So I'm really happy you explained that. Now, one of the things that I'm also interested in understanding is, are there grants or scholarships out there for certification programs? And can you also explain the difference between a certificate and a certification? Because I get a lot of questions on that too, and people seem to think that certificates and certifications are the same thing.
Oh, that is so funny, because I had an experience myself when I was going to college, and I took a computer technology class, and I struggled a little bit in that class. And then by the time the got ready to take the test for the class, okay, they sent me a certification, not a certification, a certificate, saying that, you know, you have mastered this course, you have taken the hours for this course, and then that was it. And I thought, yeah, I'm certified, you know, to work on a computer. And then I get to the class and the professor asks, okay, who got their certificates? And everybody said, yeah. And then he said, okay, next you got to get certified. Get certified. You know, I just took this course. I just received this, I thought was a certification. Now I got to get certified. What is a certification? Well, the certification is basically the test that proves that you actually learned something from the course, right? You can get a certificate all day long. It's saying that you took the course, you completed the amount of hours, you have the knowledge. Now the certification is saying, okay, prove to me that you have the knowledge. And when we give you this certification, you're going to be able to go out and say, yes, I'm certified in this field to do this particular kind of work. And the certification, without it, sometimes jobs can say, no, we can't hire you because you're not certified. And that makes a big difference when you are actually giving people, you know, employment, because they don't want someone who has not been certified, especially in their state, of course. But you know, there, like you said, there is a difference between actually getting a certificate and a certification. And the certificate is just the beginning. The certification is, hey, I've really mastered this thing.
That's right. So, excuse me. Are there certificates are there programs out there, grants or scholarships that can help people in getting and paying for our certification programs like medical coding, medical billing, things like that, that people might want to get into, or any other like the CNA program? Some of them are certification programs. But I just want to know if there are certain monies out there for people who want to do those types of programs.
Yes, 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 yes. There is money. There is money out there. Um, so one of the ways that people can kind of research the money, if they're going to the school and they're asking, hey, do you have this, you said certification program?
Mm-hmm.
And if you want it to be a CNA or medical billings, whatever you want it to be related to the healthcare field, you ask the school that you plan on attending. Sometimes it's online and sometimes it is not, but you want to go to that school. Every school has a financial aid office. So if you're reaching out to that school, you go to the financial aid office and let them know, hey, I am interested in joining this program, but I'm a little short on cash, right? You just be upfront with them. Tell them exactly what you need. And then they'll look and see, okay, well, we have this scholarship or we have this grant. Or, sometimes even schools are looking for a particular profiled student. So if I am a female African American who wants to be a medical biller in the state of South Carolina, and I go to a particular school and they just needed one more individual to come into the office and say, I want to sign up for the program.
Mm-hmm.
I am that person, then hey, I get to get the information on whatever scholarships and grants that are related to that particular course, right? I'm getting access to it because I went to their financial aid office and I said, hey, I need some funding. So some programs are inside of that particular school. And even though like the online programs that you actually, really have to come out of your pocket and there's less funding for them, there still is money there. They could also look at their state website to see what government funding for which particular program is available. Because sometimes some states need more CNAs than other, or some states may need more doctors than other. And so if they're trying to get people enrolled into a program and they're trying to build that program up, then there's funding for it, okay? There's grants that are actually there to help students, even if they wanted to get a 2-year degree. It doesn't matter if they want to get a 2-year, 4-year, if they want to go back to the PhD, it doesn't matter. There's still government funding there. So they could look at their state website, the Department of Labor website, their Department of Education website, to get those grants and scholarship advertisements there. And especially if it's a low income, there's a lot of money out there for people who are low income. And I know a lot of families who have still trying to come back from COVID and they lost income and they're still considered low income to the government. There's still money there for these people. Even if they're looking for jobs at their local career center, there's funding there. If they just go to that site and they look for careers, if they look for scholarships, they're looking for grants on that career one-stop site.
Yeah.
They can also check out professional organizations. So a lot of students feel like, well, I'm not certified yet, so I won't get into an association. There's some that you can get in without being certified. And even if you have to be certified, you still can get some knowledge from them on the know-how, helping them send you to the right place based on that particular association. So if there's an association there, they can provide scholarships and grants just for you participating inside of that association. So yes, there's funding there available for people who just want to get, their certification in a healthcare related field.
Yeah. That's great. And that reminds me of a situation I had, like last year when I was sick. I couldn't afford to pay for my books and stuff for AAPC. And I reached out to them and asked them if they had a financial assistant program.
Yep.
And they said, yeah, we have a financial assistant program. And I told them I couldn't afford to buy my books for this year. And they actually gave me a really nice package. They not only gave me my books, but I got the study guide and I got the test as well through their finance program. And a lot of people don't know that AAPC has a financial program. And if you want to become a medical biller or coder certification through AAPC, they have a financial assistant program. You could also ask AHIMA if they have one. But I also run across a lot of people who go to 2-year programs at their community college, or they go to 2-year programs through a career workforce center. And what they need to understand is that sometimes those programs, they'll give you a certificate of completion, but they don't give you a certification. You still have to go and sign up and pay for your certification through the AAPC or AHIMA in order to become certified, to be considered certified in medical billing and coding. And I wanted to distinguish that. So when you're signing up for these 2-year programs through workforce or 2-year college, you need to ask them, am I going to get a certification through AAPC or HEMA and be certified? Because those are the only 2 places. I mean, it's 3 places, I believe. It's AAPC, AHIMA, and NHA. NHA, they're smaller. A lot of people kind of stick their nose up at them, but they're a little cheaper than AAPC and AHIMA. But they also give certifications in medical billing and coding. And I just wanted to add that to that because I thought it was important, because I see people that post a lot and they're like, I can't afford my books this year. Does anybody have older books that they're selling and things like that? And I say, just apply for financial assistance through AAPC. So asking questions, always ask questions. And now you got Miss Angie right here. She'll help you out, help you with your scholarships and your grants, and give you the information that you need that you didn't even realize you was missing.
Yeah. Can I add something to that? I'm sorry, Miss Ruby. Can I add something to that?
Yeah.
So when you said the workforce, so sometimes the workforce will send you to school, but as you said that they may not pay for the certification, and they still have programs. If you go to them and say, hey, I just can't afford this, paying for the certification, there's still a program that they may let you go to work, and then you take the money that you used from the work and pay for that certification up
It's like a work program. What did they call them things in school when we went to college?
We're about ready to date our age, Miss Ruby.
I can't even remember it. I used to work in the computer room teaching everybody how to use the computers.
They used to call ours was JPTA, junior something. I'm not sure.
I can't even remember.
Training, yeah, it was a training. But yeah, you would sign up for whatever work they have available. You just took whatever job they had.
So it works kind of like that. That's good to know. That's definitely good to know.
Yeah.
So what about people who want to like become doctors, and in a specialized kind of field, like lawyers, but like a doctor? Is there a way for somebody who be in school that long to be able to pay for their education through grants and scholarships?
There is a way. The number one strategy is to start early.
Okay.
Because when you start early, you have time to do your research. You have time to do some internships, to make connections with people that are really going to give you some information, to apply for scholarships. Because sometimes you may go in on starting in August, and the scholarship you needed, the deadline was in January. So now you got to wait until next January. So there's got to be some things that you do
Yeah.
in between. So starting early will be able to give enough time to learn the ropes of the scholarship and grant process.
Okay.
So I would also recommend researching local and community resources, because people that run businesses, organizations, nonprofits, the mayors there, all of these people, they want to support their own community. They want the funding to stay in the community. So you can investigate some local organizations, especially those who deal with education, community foundations, nonprofit organizations. They have grants and scholarships. Now you may have to go to receive that money. You may have to go to a college inside of your own state, but hey, it's money that you don't have to pay back.
Mm-hmm.
And you can also contact the local chamber of commerce centers. They have information, career counseling centers, all local first, because these people have money and they want to keep the money inside of the community. As far as scholarships and some grants, there are search engines, which is basically a database of all of scholarships that are available. And then as a student, you would create a profile on these search engines and you would narrow what you want to be contacted for. So going in, I would not just say I want scholarships or grants for female students. That's too broad. I want to narrow it down to I'm a female student who wants to get scholarship and grants for students who are going to school to be a CNA in the city of Anderson, South Carolina. So you narrow it down and you can get money just by narrowing it down on these search engines. The search engines will give you notifications of scholarships and grants based on your profile, based on basically what you tell it that you want. And if you're doing that, you're able to, like I said, narrow it down and get information that's focused on your local community. If someone also if they're employed already, say if they're a CNA and they wanted to be an RN and eventually become a doctor, if you are in the healthcare field and you are already working at an establishment that's health related, then you need to go to your HR department.
Oh, yeah.
Ask them, yeah, ask them what type of tuition help that they have, whether it's reimbursement or they actually some area organizations, they send students to school. They pay for their
Yeah.
schooling to get that. Now they may have to sign a contract saying they're going to be at this facility for another year, but hey, you
Yeah.
can really tough it out for that year. You've got your education and they pay for it.
Mm-hmm.
I would definitely look into that for just getting the experience and the education at the same time.
Yeah, I worked at John Hopkins Bayview, and I remember this was years ago. I don't know if they still offer this program, but they had started a program where they were offering employees who wanted to continue their education or go to school to be a nurse. If they went to school to be a nurse, they would not only pay for their schooling, they would pay them full-time pay for working part-time.
Wow. Wow. Wow.
Full-time pay for working
Full-time pay for working
part-time.
part-time. Yeah.
Yes, and they did, and that's how they dealt with the nursing shortage at that time. There,
Wow.
there's always a nursing shortage
It
when you're in the
is.
medical field, always.
Mhm.
But for them, they were keeping people that were already in the hospital working.
Right. Yeah.
and they put them in school, and then when they graduated they had to stay there and work for, I think, maybe 2 or 3 years after.
Mm-hmm.
So that would cover them for the nurses shortage at that time, because John Hopkins at that time, they had an aging nursing workforce, and a
Mm-hmm.
lot of nurses were going out because they had been working for 30 years, 20, 30 years, and now, a lot of people don't know this, but hospitals are made of concrete, and
Mm-hmm.
floors are hard,
Yes,
and it
ma'am.
messes with your feet and your
It
joints
does. And
and
your
your
back,
hips. And a
everything.
lot of nurses leave with joint issues, and
Yeah.
so they had to find a way to cover that workforce, even though it was going to be a couple years before a lot of them would retire. So if
Mm-hmm.
they retired, then they would have a new workforce coming in,
Right.
you
Yeah.
know, things like that.
Yeah.
And I thought that was a really good idea, and a lot of people signed up for it. A couple of the housekeepers signed up for it. The people that worked in the security and in the kitchen
Mm-hmm.
signed up for it, and they probably were thinking, I can't afford to go to school, and now here they go. They work and get a job at a hospital. They'll
Mm-hmm.
help pay for it. I
Yeah.
don't know if there's any hospitals giving stuff that lucrative anymore, but
Yeah.
make sure you take
Maybe a few.
advantage.
Yeah. Yeah.
So,
Maybe a few.
my next question, and it probably is going to roll right into this, is I was just asking for adults who want to continue their education. So let's say they have their BA or their MBA, and they want to continue and get their MBA or their PhD, and they're working already. How can they get grants to assist them if their HR doesn't assist them, to assist them, or to assist them with whatever money HR gonna give them, and any additional costs? Are there specific grants or scholarships that do that for adults?
Yes. So when we're talking about adults, whether it's an adult that's working in a field already or they wanting to go into the field, we want to think of it in a different strategy. So we would consider those as adults wanting to go back to school, or adults who want to continue their education.
Okay.
So going for grants and scholarships would be like a returning to school grant or a returning to school scholarship. Because this person is probably already have some type of certification and they want to get something that's higher, but they've had a space where they have not gone to school and they want to go back. So the government, again, it still has funding available for those students who want to become returning back to college, right? And so again, looking into your state and federal government listings, there is so much because you have to think about also the government wants, our adults to be educated. They want to be able to support those who are trying to support their own community, eventually support the whole world. And so they have this funding there for non-traditional students. Again, that's another word that they would use if you're looking for grants and scholarships. You would use non-traditional because, you are an adult that has probably a family and who's working, but you still want to go to school. And it may mean that you may have to work during the day, go to school at night. There's still grants and scholarships for those type of people. And so I would definitely make sure that before a student is trying to apply for these type of grants and scholarships, you want to make sure that your resume is polished.
Mm-hmm.
So that when you apply, you show some type of evidence that you're serious about continuing this field. So if
Wow,
I wanted to got my
that was
CNA
a
and
nice piece
I
of
haven't,
advice.
I'm sorry.
So that was a nice piece of advice about the
Oh,
resume.
yes. But if I'm a CNA and I've got my certification, I've kept it up, but I haven't worked into the field for 5 or 10 years, and they're gonna look at, well, what happened between the 5 and 10 year span. They're going to be looking at, were you really serious? Am I going to be wasting my money by giving it to you to go back to school to get, your next degree? So making sure that, your transcripts are definitely clean. You know how to write an essay, because with grants and 95% of the scholarships, they're going to ask for an essay. So you can't be the type of person that doesn't know how to write an essay to tell me why you should get this grant or why you should get this scholarship. With our students that have so much technology out there now, it's easy to do. It's easy to learn how to actually become good at writing an essay or telling about yourself. So making sure, and there are with the career centers, and they have like organization inside the career center that helps you with your resume. If you don't know how to do it, they help you make sure that it's updated and teach you how to write it. So that's no excuse there. And then again, I would probably, if the professional organizations, again, I would definitely look into the professional organizations to see where they could assist as well. Networking with individuals who've been through what you've got to go through, seek advice. How did they make it? How did they find the funding there? Career counselors, again, that academic advisors, all of those can help point in the right direction of the type of scholarships and grants that are available for these type of students. Networking events, social media groups, all of those can help.
Angie, you also offer this type of assistance, right? Do you help people write their grants? Or do you at least guide them through writing their grants so that, what if they're a person who has tried for a grant several times and they keep getting rejected and they want to finally get approved this time? Do you help them with services like that?
So grants are not my specialty, but the type of essay that has to be written in a grant and scholarship are pretty much the same. You're pretty much wanting to match the mission and the vision of the organization that you are trying to get this money from. And you're telling them what you've done to match it and what you plan on doing in the future. With the scholarships, it's basically, it could be your essay, your transcript, and maybe one more thing. But with the grants, it's more like page 1, page 2, page 3, page 4. And it keeps going on. It's just an extensive thing. So it takes a lot more time to apply for a grant on that level. Now, some grants are simple. Some grants, it just says, send me proof of this, and then we will actually look at your application from there. But it just all depends. So I don't specialize in grants, but I have resources for people who are interested in, needing some assistance for that.
Okay, so they can contact you if they want to get additional information.
Yes, yes.
Well, this was a lovely conversation. I got a lot more information than I thought I would. I really appreciate you showing up, Miss Angie, to help people in the healthcare professional who want to get into the healthcare profession find funds to assist them in their journey. And before we go, can you introduce yourself again and give us like your contact information for your social media and your website?
Yes, so I am Angela Hill, the Inspirational Scholarship Coach. I work with parents of students who have high school students who are looking for scholarships to pay for college instead of student loans. I can be found on LinkedIn, Angela Hill, Journey Changers, and I am Facebook, Angela Hill, Inspirational Scholarship Coach, and also on Instagram, Journey Changes as well.
Do you have a website?
I do not. Right now, I'm just on social media.
Okay, that's great. That's great. Do you have any upcoming talks or anything, videos that you would like to inform our viewers about so that they can catch you later on social media?
So what I have right now is inside of my private Facebook group. It's Scholarship Solutions, resources for parents of high school students. And I come in there every other Tuesday and I do a live training on scholarships, anything related to going to college, anything on that nature. And I'm actually having at the end of the month a masterclass. I have not set the date in stone, so I can't
Okay,
really
so to be announced. So
yeah,
all
yeah,
right.
yeah. But following me on social media, you'll be able to get the notification of when that will go live.
Okay, great. Thank you so much, Miss Angie. So follow Miss Angie, and she will help you out on your schooling journey, getting those scholarships and assisting you in finding grants. Even though it's not her specialty, I just want to make that
Thank you.
I will just want to make sure that you understand that. And my name is Ruby Simmons. I'm your medical billing mentor and owner of Blossom Revenue Cycle Solutions. And you can find me on LinkedIn at Ruby C. Simmons. You can find me on IG at Blossom RCS LLC. My website is blossomrcs.com. You can also in my IG, in my smart links, you can find access to all of my Facebook groups. I have your medical billing medical billing mentor Facebook group, where I come in on every Friday and I do a medical billing mentoring minute. And I also upload freebie information for medical billing, like tests and guides and things like that. I also have the Medical Revenue Strategy Facebook group for healthcare professionals who are in revenue cycle management or medical billing, and they're having issues with their AR and they need to ask somebody some questions to get them started on how to clean that up. And I believe, I also have a brand new membership site, and the summer sale right now is $47. After June, it will go up to $197. And I have an upcoming masterclass on understanding insurance, where you will learn how to research insurance, how to look for the policies, and how to call and talk to a representative for insurance. And if you purchase this course, you will get a free month in the membership site, where I'll be putting in drip content of everything that's in my head on medical billing and revenue cycle management. And I believe that's it. Oh, catch me on Clubhouse every second and last Sunday. Every second and last Sunday, where we talk about different topics. Last Sunday we talked about Medicaid. Not this Sunday, but next Sunday we'll be talking about workman's comp. So if you having issues with workman's comp, or you're a patient on workers' comp, or you know somebody on workers' comp, catch me on Clubhouse. And I believe that's it. So thank you so much, Angie, for stopping in, and thank you everybody for staying and listening to this recorded video. Thank you so much, and have a wonderful weekend and a wonderful day. Bye-bye.
Bye-bye. Thank you.